Okay, good morning everyone and welcome to this special meeting of Vegreville Town Council on September 17th. I call the meeting to order at 9 o'clock. Okay, so we're here to discuss some of the new regulations and rules that the province has brought in regarding COVID and vaccinations and stuff. And so we're going to turn it over to Cliff, and Cliff is going to give us his thoughts of how this process should be.
Thank you, Your Worship. I would like to make a comment at the outset of the meeting here. I believe that because this deals with employees, is what we are looking at for the purpose of this meeting, that this is an operations decision, and through the CAO bylaw and through policies that Council have passed to provide a safe and healthy work environment, I believe that this is an administration decision. I just want to be on record for that. However, the protocols that were brought down by the province of Alberta on Thursday come into effect on September 20. And there are a couple ways that the town can go. Senior leadership, together with Jameson Brown, met yesterday, which is also our municipal emergency management agency, discussed what the requirements are based on the information the province forwarded out on Thursday night after the announcement. So the first is for business requirement, proof of vaccination, and we are looking at this as for the employees of the town, is what our jurisdiction as administration is looking. So a single dose accepted between September 20 and October 25 if received 2 weeks prior before time of service. A double dose is required after October 25. Further on the provincial website, the second doses can be administered 28 days after the first dose. Otherwise, documentation of a medical exemption is required, or proof of a privately paid PCR, which is the COVID test, rapid test, within 72 hours. So this would be every 72 hours or 3 days. The employees would be required, these are employees that are not vaccinated, would be required to show a negative test every 3 hours, paid for by themselves, and this test would have to be completed on their own time. We also discussed what this meant to our facilities. The administration and public works building, public access doors would be locked. Signage would be posted instructing patrons to call the office line for entry. This is the same process that was used when we had our lockdown earlier in the year. Only those who show proof of vaccinations will be allowed inside the building. Those who are not vaccinated will be reminded of other service items. And the majority of people that do come to the town office are for bill payments. There are options in paying bills either online through the financial institution or through Dropbox. Those were all in place and have been for a number of years. And we've also added this year payments through our website. The fire hall will remain closed to the public. The landfill, Vegreville sanitary landfill, will be exempt from the restrictions exemption program, including a limit of 1 patron in the office at a time, and they are 3 meters apart in the office. So, aquatic and fitness center Wally Fadoon Arena and the multiplex, proof of vaccinations will be required for all eligible patrons, ages 12 and up or non-medically exempt. Staff will be required to ask for proof of vaccination at the Aquatic and Fitness Center at the front counter. We will have signage posted for the arena and the multiplex. However, it is the user group that is responsible to provide proof of vaccination of the users of the, or I'll say teams that are using the arena or the multiplex. The social center, and we would also look at canceling public skating at this point. Social center, leasers of the Vegreville Social Center will be legally responsible to ensure all vaccine eligible guests attending the events organized by the leaser and the organization they represent have provided proof of vaccination. There again, it's not the town, it's whoever is renting the facility that would have to provide proof if they are questioned. We have understood that there will be Alberta Health audits and potential spot checks on different facilities. So what we're looking at this time is to implement for employees the proof of vaccination. With the provincial guidelines, they must have their first dose by October 25th at the latest. We are looking at the second dose. We're putting a deadline or recommending a deadline of November 30th, which is 4.5 weeks after the deadline of October 25th. And that's contingent on supply of the vaccine, of course. Okay.
Okay, thank you, Cliff. So I'll start with the first question. Senior admin's understanding of the new regulations is that no business is allowed to be open unless they implement the vaccination portion of the what you're saying is that nobody will operate unless all their employees go along with the restrictions and the guidelines within there.
The guidelines from the province say that business requirements, businesses that implement the restrictions exemption program can operate as usual if they only serve people ages 12 and over who have proof of vaccination, documentation of a medical exemption, or proof of privately paid rapid test, a negative rapid test, in the past 72 hours. That's what the province has laid out.
So I will open this up to questions from council to admin, and I seriously want everybody to be very respectable when they're asking for definitions. The province has not been real clear on everything. So as I asked, is dialogue that is respectful. But Paul, Casey, you have something you'd like to add to this?
Excuse me. What CEO Craig has said is with respect to the restrictions exemption. Businesses can continue to offer without the restrictions exemption. However, there are significant issues, or not issues, that are significant other things that have to be done if we choose to operate without restriction exemptions, which would make it probably more onerous, especially for the town's recreation facilities to operate. So.
Okay, so we'll start here with Councillor Warwick.
I want to break mine into a couple different questions because I want to be clear, I don't believe that we're talking about one thing. It is not the same. I have actually spent more than 4 hours yesterday on the phone with people, and I've gone through all the regulations. Some of what we're talking about is business regulations, so I just want us to ask questions that are related to town facilities. So we have town facilities and we have the employees. Those, I believe, are two very different topics. So one is whether or not we're going to be asking our town employees to vaccinate or not. So my first question, if we could, would be about the town employees. So my question would be this: if we were to go ahead with the process as it is, because we were saying the 20th they would be required to have their first dose, we do know there is a portion of our employees that don't have it. What would be the plan for them? Because we're saying their first dose would have had to have been the 2 weeks before for them to be eligible, for them to have it be taking effect. So what happens for them? Because they didn't have an opportunity 2 weeks ago to know they had it. So that would be my first one.
Okay, the first dose, according to the province, has to be by October 25th.
Okay?
Okay?
So in the meantime, they would, every 3 days, have a check, a test done at their own time, at their own cost, and keep bringing it to us up till the October 25th.
What we are looking at is, as long as they have their vaccination prior to October 25th, we would not require the test. But if they are not vaccinated after October 25th, we would require the test, is what we are looking at. That gives a chance for the employees that are currently not vaccinated to at least get their first dose. After the requirements,
Sorry, Cliff, did you say October 25th or September 25th?
October 25,
So they have up to October 25th for their first dose?
correct.
Okay.
That's laid out by the province.
I thought we were implementing this on Monday.
We can implement this on Monday so that employees are aware that effective, the single dose has to be accepted between September 20th and October 25th. And the province says if received 2 weeks before time of service. So if they have their first vaccination, and the example would be an employee that is unvaccinated today. So if they have their first vaccine between September 20th and October 25th, they are in the process of being vaccinated. That's the view that we interpreted that. Double doses are required after October 25th. So, but there again, if they wait till October 25th to have their first dose, within, not in this regulation, but within the provincial guidelines prior, there's 28 days that are required after the first dose to have the second dose. So we are allowing about 4.5 weeks. So we were using November 30th as a deadline.
Okay, well, the reason I asked that question is because that is different than how it was just explained. We said as of September 20th. So when it was just explained, it made it sound as if the provincial regulations were saying as of September 20th, and that's why I was arguing back, because I knew that as of September 20th, being Monday, we were just saying a second ago that as of September 20th, we wouldn't be able to operate and have employees in. Now we're saying the 25th. So those are two very different stance. That's why I needed clarification.
Okay, there's some other questions, but for clarification, Paul Casey would like to interject something here.
Yeah, I think the confusion is with respect to when the exemption restriction has to be put in place. We can opt into the exemption restriction on Monday. So on Monday, if we want to continue to operate our recreation facilities without having to go through onerous things, we have to opt into the exemption restriction. The exemption restriction then goes on to say that it does not imply, the exemption restriction requires that we only serve vaccinated people if we opt into the exemption restriction. We can only serve vaccinated people. However, that doesn't include employees. Employees don't, under the exemption restriction, do not have to be vaccinated, but it's our position that all our employees should be vaccinated, because if we have employees that are out servicing the public and going into their houses for whatever reason, for instance, who are not vaccinated, that creates a problem in our point of view. So our position is that all of our employees should be vaccinated, and in accordance with the guidelines under the exemption restriction, that's where the September 20th to October 25th date range comes from, and then the, after October 25th for the second vaccine. Now, under the exemption restriction, if you're considered vaccinated, your first vaccine, if you've had it 2 weeks before you come to use our service. We're not requiring that of our employees. We're saying, get vaccinated. Go through the process and get vaccinated. We're not gonna stop anybody from coming to work until after the deadline for the second dose. If they haven't got their second dose as of November 30th, then we will see what we have to do about it. I mean, and of course, we will allow for human rights or religious exemptions as well, because we have to do that. So that's what we're asking, is that all our employees get vaccinated so that we can operate safely for the public. And then the other option, the other issue is the exemption restriction that we need to opt in on Monday. Otherwise, we have to consider closing all our recreation facilities because it's just become like it was before, where you have to
I
have
appreciate
somebody-
that. That's a good explanation. I just needed to clarify that. So the clarification is the November 30th, they would still be able to come to work up until then. The recommendation is to have everybody vaccinated. However, to be clear, that would be a choice or a decision to make them vaccinate because it isn't a requirement. Okay, that's all I wanted to know.
Okay, okay, Cliff, go ahead.
Just further clarification on that is especially with our facilities, if we are requiring users of the facility to be vaccinated, we shouldn't be having employees in the facility that aren't vaccinated, that are operating the facilities.
Okay, so Councilor Riddick first and then Councilor Lemko.
Thank you for the clarification. I know this is a lot of information to digest as staff, not much less for us as well. And it seems to continuously be placing new considerations that we've never had to. My question is about the timeframe awaiting the first vaccination. So you had referred to that as they're going to be vaccinated. So in that interim period before they actually are vaccinated, is there a requirement that they would be providing that 3-day PCR testing verification? Would be my first question. And then my second question is, have we reached out to Alberta Health Services or to other providers to make sure that we make it easy for our staff, for those that may not have had the time or the opportunity or the understanding that it was necessary to continue employment? Are we making that available to them?
Go ahead, Cliff.
To answer the first question, we will not require the testing until after November 30th, which is the deadline that we have put in for having the second vaccination. As long as they are in the process, like I said, for September 20 to October 25, with the information from the province, they are to have their first vaccination. Double doses are required after October 25, but we also know that it's 28 days, so we have put November 30th in place, or would like to put November 30th in place.
So,
on the-
so what you're saying basically is September 30th, if someone doesn't have a vaccination, they are not gonna qualify.
November 30th
November,
That's the second dose deadline.
for the second dose.
oh, so the first dose
The
by
first
the
dose-
25th of October.
Correct.
So if they don't have it by the 25th, then,
Then, if they don't have a first dose by October 25th, they're not going to meet the deadline for the second dose for November 30th.
okay.
But the province has said October 25th. To answer your second part of the question, tests from Alberta Health Services or Alberta Precision Labs, which is on contract to AHS, are not allowed. These have to be privately paid rapid tests.
And sorry, my second question was about the provision or the access to vaccination. So if we're making the requirement or the request of our staff that they be vaccinated, are we providing the information to them? And I understand that it is exhaustive and extensive, but I'm going to make the parallel, for example, for COVID testing right now. I know from firsthand experience that the testing is not as easily accessible or convenient as it once was, and I have been hearing stories of people not getting tested because it is so onerous.
Okay, I'm sorry, I interpret that as testing requirements. The vaccine requirements, we will reach out to find out which vaccines are available at which locations within our region.
Okay, Councilor Lemko.
My question is around the proof of vaccination, where it was said September 20th to October 25th, proof of a single dose is considered acceptable as long as the dose was given more than 2 weeks before time of service. This administration's interpretation of what it means was given more than 2 weeks before time of service.
Go ahead, Glenn.
Okay, the time of service applies more to users of the facility. What we are looking at is as long as the employees are have their single dose prior to October 25th or prior, then that's acceptable for us. And then they have to, we need to put in a deadline for the second dose, because if we leave it open, people may never go for their second dose. So that's why we used November 30, because that's about 4.5 weeks after the first dose if they use October 25 as their first dose. Okay.
Okay. So when it comes to patrons of our facilities, people coming in, they can't download the app because it all crashed.
Correct.
So we're gonna take people's word right off the bat. We're gonna take proof of vaccination on a paper form. What's the schedule there?
It's the Aquatic and Fitness Center that our employees will be doing the screening or questioning of patrons for their vaccine. We have the means where we can deny access to the pool or to the fitness center by going through, going by the front counter. For the arena, the onus is on, and the responsibility is on the user of the facilities. So whether it's a hockey group or figure skating or whatever, they're responsible to check on their own members.
My question has more to deal with the proof of the client that's coming in.
As a personal example, I have just received my code for the app, but I haven't been able to get onto the app to finish the completing the setup. I have a paper copy at this point from the pharmacy. That's all I have at this point, and that's what I would have to show as proof of my vaccinations.
So we're saying, no matter what, come Monday, if you don't have a paper version of your proof, because nobody else can download the app.
We will accept a paper version, or if they've been fortunate enough to have it loaded on the app, we'll accept that.
So I have nothing, so
So-
I'm built in the building.
So would you consider extending the date for people coming into the facilities for at least a week? I mean, I had a lot of people that are in the queue, like they're 119,000 away, and the minister has asked no one to go on the site.
Correct.
So, I mean, not everybody knew at the time when they got vaccinated to carry that. So could we extend that by a week, or, I mean, I guess everybody could somehow get a paper copy. I don't know how. Don't ask me
You have
how.
to call Alberta Health Services, you'd have to go into the health unit and get them to download it. Right now, that's the only way.
Okay, Paul Casey.
I received a paper copy of my vaccine status from my pharmacy yesterday. I just went in there and asked them for a printout of my Netcare vaccines, and they gave me a printout of all of my Netcare stuff, and my COVID vaccines are right at the top. So you can get it if you go to a pharmacy, I presume, and ask for it.
So would we consider giving a week's grace, and we explain this to people as they come into the facilities, that this is what's gonna be needed? Or are we gonna start right on Monday?
We can give whatever grace period we deem reasonable.
Go ahead.
Okay, so now I want to go into the facility portion. So I understand what you're saying with the aquatic center based upon how they would enter into the building. So that I think makes sense. I understand how they would bring it in. My question is this though, when we say that now I had a long extensive conversation with some people yesterday because none of these exemptions are attached to buildings. They're attached to the programs operated within the building. That was explained to me multiple times, and that's why they said there's different dates on everything. So I understand logistically and nightmare-wise, I don't think we have the resources and staff to start chasing down a million different programs. I think that, I understand that totally. However, we just said we're putting it on the user group. So if we're putting it on the user group, I'm just wondering why we would be looking at doing regulations that go beyond the provincial recommendation, because the province has taken sports recommendations and they've broken it very, very clearly, not only into two exact periods, two exact groups, they've also broken into two timelines. So for the 20th is where they talked about adult sport and recreation, and that's why it was the adult one. For the youth, they used the fact that they said that the youth weren't the ones that were suffering as bad from the illness. They actually implemented as of the 16th. This was already as of yesterday. The youth groups were to begin the process. And the youth process is different. They are not required to do the vaccine. They're not required to provide proof of the vaccine. They are only required to follow the same regulations as before. They are allowed to, of course, wear masking indoors, but then once the physical activity comes off, they are able to take that off. And they are allowed to have a spectator being the family member, just as the regulations were before. So the province has clearly outlined that there is difference between adult activity and youth activity. So what I'm wondering, and I understand the resource question, but just because you said that the onus will become on the user group, if the user group has been identified by the province in a different group, why are we asking for a stronger regulation?
Go ahead, Phil.
Okay, so you're
Yeah,
correct.
right.
So let's just take the hockey, for instance, we use it as an example that everybody can understand. If it was just a adult hockey program, just an adult hockey program, let's say adult rec hockey, if we implement the restrictions exemptions program, only fully vaccinated players can play in that adult hockey. We would not be policing that. It is the user that rents it that would be policing that and would be responsible for it. For minor hockey, because the athletes are under 18, if we implement the restrictions exemption program, the athletes only need to be screened by the team. So just a normal screening process. Have you been, just like all of us have done the little check boxes. But if you're an adult, as part of that team, you have to be fully vaccinated. If we don't do this restrictions exemption program, then when it comes to minor sports, our facility will go down to 1/3 of its capacity, and then each player would be allowed the two people from their household to sit in the stands, all socially distanced. If we implement the restrictions exemptions program, then coaches that are all over 18 have to be fully vaccinated. The players do not have to. They just get screened for symptoms. They wear their masks in the common dressing rooms and then go play their hockey without their masks. Then you're allowed 10 fans in the stands as long as they're all fully vaccinated. Does
That makes sense to me, but I'm wondering if we're putting it back on the user group, and given that it's supposed to begin as of the 16th, if we're putting it back on the user group, why aren't we then asking the user group which way to go with this? Because right now, we are in a position where we could very easily be shutting down a number of teams if we are going with this route of the exemptions. Because are you not saying then that if we go the exemption, everybody's required to provide the proof, or are you saying it will only be the adults in the building required to provide the proof?
Only the adults. Kids are not required. If it's a youth sport, kids are not required to have a full vaccination. They're simply required to do a screening process that they haven't been around anybody, they haven't been out of the country, they don't have a cough or cold or sneeze, whatever, and do that screening.
I guess I'm just asking based upon the fact that there's regulatory bodies that actually deal with these. So the regulatory bodies that would deal with it would be your leagues, your Hockey Alberta, and I believe that there's a very good chance they're going to pass these regulations, that they're probably going to say that all coaches and adults within, I think that we can expect that to come, but they haven't. The province hasn't. And other leagues, like our Junior A League that happens to be there right now, does already have that as part of their league as a requirement, which is why it kind of makes it a little bit easier for them because they're already in that. I guess I'm just was wondering why, when we don't have to and we're putting it on the onus on the user group, why we aren't giving either the user group an opportunity to decide, or at least an extended timeline to get this into place, because otherwise we are really impacting the user group and we're going above provincial requirements.
But the way I see it is the youth are on a whole different schedule than the adults. So it's up to minor hockey to police their own. The facility that they're in is falling under those restrictions. So, but if you're an adult, in an adult league, you need to fall into the proof of vaccinations.
Yeah, that wasn't how they explained it to
Okay.
me yesterday, because they said that that would be the people within the activity. But also, I guess the biggest one comes down to timelines. If we're saying that everything will be easy within that timeline, like if you're giving a big, long, extended timeline, that's one thing. If your timeline is the 16th, which was yesterday, that actually closes programs down. So we do have to clarify how long a timeline we're giving before that be implemented.
Okay, go ahead, Phil.
So yes, this could affect all our users. I mean, so the pool and the gym, we control directly because they pay us to use that facility, and we allow them in and out. For hockey, skating, dance, we rent a facility to that group. And so, for instance, for a hockey game, it would be very onerous for us to have somebody sitting at the door checking vaccinations, and when it should be the user group that is monitoring that. And that's exactly what we did back in 2020 when we started up the season. Was the onus was on the user groups to ensure that the proper measures were being followed, and if the measures weren't being followed, then it was the team that suffered it, and then it went up to the whole association. We gave people that opportunity back then. It said, if your team doesn't comply, your team will get the warning. And if they don't comply again, then the team will be suspended. Then, after that, it'll be the organization that gets suspended. So we were basically telling those user groups, it's up to you to work with all your parents, and because it is the adults that are going to be paying for the price for this, really. They are the ones that have to be fully vaccinated, and they're the ones that are in the stands mingling. We don't want to penalize the children playing the sport, so we put the onus on the user groups to ensure that the rules are being followed.
I guess I'm just saying, I think it's a lot more onerous on a user group to have to go into their spectators and literally try and give proof of vaccination for every one of them than it was for them previously to count the number of spectators allowed in. That was a lot easier for a user group. And again, that's where clarification before this should ever be implemented should be looked at, because when I had the discussion yesterday, they said that it was not where everybody over 18 had to have it. They said it was because it was talking about the sporting event. So they are looking at the fact that the sporting is where you have more droplets and exchange. So that was what was explained to me. That's what part I'll want clarification on, because under the youth, it does give provisions for their training, and it says, but participants are required to. So they said then participants, it was explained to me that that would be anybody that was within the team that was a participant, including the coaches. They also said that spectators were addressed within the youth, which was not saying that those people had to have vaccinations in order to be there. They said spectator attendance would be restricted to the 1/3 the fire code. So they were saying that if you do not choose to then implement where all adults are vaccinated, then you would have to go to the 1/3. So I guess that's just a clarification that we'll need, because those are two very different things. Saying that all adults in the building have to have, because what we were told is that it isn't all adults, it's about the physical activity, not just that a building itself requires every adult within it to be vaccinated.
My take on that would be the youth are exempt because they're youth from having vaccinations. I would imagine Hockey Alberta would want all adults to have proof of vaccinations. I mean, we cannot say that anybody can come into the arena, fill the arena without having proof of vaccinations. I mean, it clearly says that it's for the youth. I don't think that it says that anybody that belongs to the team, any parent is allowed in the facility without a vaccination.
But it clearly says that if you are in here where they don't require it, spectator attendance is 1/3. That's why it's 1/3, is because they're not requiring the vaccine to be proved. You're not required the proof of vaccine. This is the program that they outlined for youth, which includes spectator attendance is restricted. So that's the thing, and I agree, I think Hockey Alberta will do something with it, I honestly do believe, but the point is they haven't. The point is that, they haven't at this point said coaches are required it. They've gone ahead and given a provision. I'm sure that the provincial government did not think that coaches and nobody was actually watching these kids' sporting activity. They didn't think that a team was going out there with no adult, and there's not one word about it being required there, because the understanding is this is the exemption for youth sport.
So if that 1/3 only comes into play if we do not implement the
Yeah.
restrictions exemption program.
I understand.
The dance studio, if we implement the restrictions, the dance studio, the kids under 18, they can go and dance. All they have to do is have a screening. Any adults in that dance studio, in that facility, have to be fully vaccinated if we have this restrictions exemption program in place. If we do not go with the restrictions exemption program, the kids can still go and dance with a screening, but only 1/3 of capacity in attendance for the audience outside of the dancers can be in that room, and it has to be limited to 2 people and a household. If we implement the restrictions exemption program, the kids can go dance. Under 18, they still get their screening, but any adult in there, anyone can go watch as long as you're fully vaccinated.
And I get that, and I understand it, Phil. What I'm saying, though, is it's not a building decision. It is an individual program decision. So therefore, I'm asking why administration, and you know what? These groups may all decide to go this way. They might say, hey, it's easier. We don't want the onus. What I'm asking is why we would not, when we're saying that it's onus is put back on the group, why aren't we then going to the group and asking them which of the 2 programs they want to implement? Because it's not a case of we have to put this in and it impacts everyone, because it's not a building restriction, it's a
But
program restriction.
We can't say, oh, we're gonna do restriction exemptions in this building, we're gonna free this one up, we're gonna do.
Well, actually, you can, Phil, because it's not a restriction to the building, it's a restriction to the program. So the program is the one that has the restriction. So if minor hockey or the dance, let's say dance, so we're not always talking hockey, if dance wants to say, we are not going to go with the restriction program, we're willing to suck it up and only do 1/3, then that's what they would do. They, as the user group, would have to select and do it. It shouldn't put any more resources on us, because they're required. That's the only point I'm making, is it's not a building. It is a program.
Oh, sorry. Who was first over here? All right, go ahead, Cliff.
Clarification under the indoor recreation facilities. The following restrictions apply to any indoor facility that does not implement the restriction exemption program. So this is where the capacity would be limited to one, or restricted to 1/3, and attendees must be household members. It's referring in here to the facility.
Yes, and then it further
Okay.
breaks it down
And
to
then,
the individual.
and then it has outdoor events and facilities. So I look at this as the facility. It doesn't say anything about the program in this part. We are looking at the restriction exemption program, town, or for our operations townwide.
Okay, Councillor Waters?
Okay, I think I'm a little confused here, talking about the program and talking about spectators in the facility. So we're talking all people as a whole, people involved in we'll use hockey, the players of the hockey team and the spectators as a whole, or are we talking 2 separate entities?
Because that's how it's broken down in their programs,
As the whole?
as an activity. When they give those restrictions, When they give those restrictions, they're breaking it down as an activity. And the thing we have to remember is that all of these are restriction exemption programs. A lot of them talk about, you know, for businesses and different things. But when I understand there's facilities, but then they break down the actual individual activities. And that was as a whole. That was saying that group, if it's a youth activity, they broke it down that way.
I think that's where I was kind of getting lost a little bit, program versus spectators, but it's, when we're talking facilities, we're talking everybody as a whole, obviously. So it's gonna be one way and not multiple different facets for different groups.
Well, I don't think we could ever enforce anything else other than what it clearly states is what I think is that if you are running youth programs and sports in your facility, that the organization will be in charge of looking after the youth, but we can't have capacity at watching a minor hockey game under these exemptions without adults and it being proof of vaccination. That wouldn't work in our facility. That can't happen.
Well, then we are going above their regulations, that's fine. I mean, I guess that's my point is the regulation, I understand they're talking about facilities, but we can't have it all ways and put everything on our groups. So if we're saying that the facility, if we're gonna hide under a facilities rule, then we're required to deal with it, to do things for them to check their vaccine. But if we're saying the user group is responsible, then we need to go into what the regulations were for the user group. And that's why they have a different category for the under 18 and they talk about spectators. The under 18 was never going to be required or forced because could be 10-year-olds that can't even take the vaccine. That's why I'm pointing this out, that that's not how to interpret it, because a 10-year-old or 5-year-old is in hockey, but they can't take the vaccine, okay? So that's why they have a different set of restrictions for the group that's under 18. And they address the spectator thing. Now, I don't think it's gonna be an issue in the long run. If you want the truth, I honestly believe that Hockey Alberta and the legislative bodies are just gonna say it's a requirement. I think that's all coming. What I'm saying is, right now, today, I don't wanna see us do this on Monday and shut down a whole bunch of groups because we're saying we're making this a point on Monday when it's not even possible to get everybody into the exemption run, and there is a category for this group because everybody is still operating this way with these regulations.
Councilor Rudick.
So I would guess that based on the diverging points of interpretation that I'm hearing right now too, is that because it's easier, it makes more sense in the long run to make it more universal for all user groups. And I would say that the differentiation that's even given in the regulations at this point are confusing. And for that reason, it's very difficult for every municipality, not just ours, but everybody trying to implement this. So for the ease of our staff, the ease of our user groups, and the public health of our community, that there needs to be one decision made. I think that probably is the underlying reason why that there is potentially a more restrictive interpretation at this point. What I'm wondering then, is there a way to be able to have this conversation with the user groups? I understand that everything has come up quickly, but there are user groups that are both businesses and volunteer groups. Their considerations are different. Because I can tell you that the conversations that I'm hearing from businesses, for example, that are renting our facilities to provide classes to youth are approaching this quite differently than volunteer groups, understandably, because their bread and butter is reliant on it, not just providing sporting opportunity. So is there a possibility to have these conversations with the user groups is my first question. The second question I have is the rules that were in place before, there was concern from parents that felt like the user groups weren't complying with the regulations of the province or our regulations, and they didn't feel comfortable bringing those forward. I did bring that forward in this meeting a couple of times. It wasn't addressed. Those parents did not feel heard by their organization or by the business, and very difficult for them to be able to lodge those complaints. So I guess in the interest of being able to be preemptively proactive, is it possible to have those conversations? And is there a dispute mechanism in place? Because again, we have throughout this entire process with COVID-19, for example, at the Visitor Information Center, had youth. We had every one of our facilities closed, and we had under 18 or 18-year-olds working at the Visitor Information Center throughout the entire summer last year when all of our facilities were actually closed. So I would just like to make sure that we're consistent, and I understand that it's probably easier if we have a rule for all of our facilities. understanding that there are some discrepancies, like Councillor Warwa has laid out, and it is confusing. So I don't know who would like to answer that question, but my two questions are, is there a possibility to have a conversation with the user groups that are impacted by the decisions that we're making here today? And is there a dispute mechanism in place if there is a discrepancy or a disagreement with how the user group is applying those rules?
Okay, so for the first one, yes, we can certainly have discussions with the user groups. Is it possible to extend this, reading through this? Yes, there's so much interpretation in here, but could we make an exemption for the arena for 2 weeks? I don't see why you couldn't, where it would now, but effective September 20th, we have to choose one or the other. So if going to the exemption program is not possible on the 20th, then our facility has to be reduced to 1/3 capacity, and the groups have to be single cohort households. The players, effective the 20th, are still gonna have to get a screening. That's mandated in here. So that is going to have to happen on Monday for dance, soccer, hockey, you name it. Any youth sport, they have to have that screening, because that's in these,
Actually, the 16th.
six,
Yeah, so it started yesterday, where we went right back to the regulations.
oh, sorry,
that we
20th is the adults. So effective immediately, the youth have to be doing this already. So could we extend this for 2 weeks to have have discussions with user groups? Yes, we can. The capacity is just limited, that's all. And who knows what's going to happen, like you said, with Hockey Alberta, are they going to mandate this? We don't know. Again, and this came right down to, we're doing it all or none.
Can I ask why it's all or none though? Because again, that's the point that I'm having the issue with. It doesn't need to be all or none. If it's a user group, they can apply to the user group. That's why there's different regulations. These regs don't shock us, because this is exactly going back to where they were before. We already had 1/3 capacity. We were already required to screen them. We were already required to everyone that's here, they just re-implemented what they put on us last year. This isn't new. That's why I'm like not understanding why it's hard to say they had to do it. And that's why they made it for the 16th, where everybody else was given time to change the regulations. They very clearly did it literally for the 16th, because it was going back to what it had always been. That's the point that I'm making about it. They were pretty clear by doing it without any day's notice, saying as of tomorrow you do it, because it's only what it always was. We've been only allowed 1/3. We had to do that. We had to send out to teams when teams came in, letting everyone know they could not bring more than, we actually had to get rosters last year from the other teams to find out how many kids they had, to tell them how many people could come in the building. So that's the point I'm making, is this isn't new.
Are you suggesting that minor hockey goes ahead without proof of vaccination for adults in the building?
I'm saying that's exactly what's in the regulations,
Yeah.
and
So,
I don't think it
well,
should be
then we-
forever, but a time period, yes.
Well, we wouldn't be able to ask our employees to work in a building where we're not subjecting the people that come into that.
Our employees will have till the end of.
Yeah,
Yeah.
we can feed off of that, but
Yeah.
moving forward, Councillor Riddick.
So I understand that that was the rule before, and I think what you're highlighting is the inconsistency of the provincial government's mandate. I guess what I was implying by my question is that I think in order for people that are using our facilities to feel included, heard, I mean, that's kind of how we're feeling as a municipality. We weren't heard, we weren't consulted, and the magic wand was waved and we make this decision immediately, which is difficult. I would say that it is confusing if we go to 1/3 and then to full capacity. I think for the sake of coherent decision-making as a governing body for the community, that we need to have consistency across our facilities. So I understand that's contentious, and I understand that it's not the same as it was before, but I think for consistency, for our staff, our user groups, businesses or volunteer to use our facilities, we must be consistent. If the province isn't consistent, we at least must try to be following the regulations, especially since it's starting right away. But the other part of my question is, if there is a dispute, if a user group member is not happy with the user group or the business in terms of following the regulations, is there a dispute mechanism?
So in response to that question, we did I was alerted to a couple last year, and we did have discussions. I didn't hear anything beyond that, so I didn't follow up. But we did have discussions, and we know that there were people that are eluding the rules. And again, that has to be a joint effort, not only with the town itself, but it also has to be the user group, because it was the user group that was going to be punished if rules aren't being followed. That's, if that makes sense. Like, it was clearly set out that if a team had a bunch of rule followers or non-followers, it was that team that was gonna get penalized. And then if it continued with other teams, then it was gonna be the organization, because we needed, either we staff it and police it all ourselves, or we put it on the user groups to police it and ensure that it's, because it's their parents, it's their adults, it's their teams that are using our facility for the purpose of recreation under specific guidelines. So either we police it or they police it, and we did work together. And the two that I talked with, I never heard anything beyond that. So I don't know if there was other concerns, that if they weren't
Okay,
brought to me,
that's,
so, yeah.
I mean, I do not want us as a municipality to get involved in disputes between parents and executive minor hockey, minor soccer. I've been on both of those boards in my life, and it is something that we wouldn't want to be involved in. So the question right now is, how are we going to move ahead with the regulations regarding minor hockey or youth groups for the first little bit here? I mean, because I would imagine that they're all gonna have their own guidelines within a certain amount of time.
That's what I think.
So, do the coaches need to be vaccinated before they're allowed in our facility? I would say that Alberta Hockey's probably gonna mandate that. But for right now, that we're giving everybody else the chance, our employees and people going into the facilities, a certain amount of leeway here right now, that we should maybe show that to the user group for the youth activities, that within X amount of days, that this is where you need to be. And until they get mandate from their parenting body, then that's the way we could look at it. But we still have to apply for the overall permit for all of our facilities.
You don't have to apply.
Well,
Yeah,
we have to notify the
choose.
government, that's what we're doing.
Yeah.
Yes. Okay, go ahead.
So my reason for that question, the dispute mechanisms, again, the divisiveness of this issue in its application has reached families, it has reached friend groups, and as you highlighted, there are a lot of personalities involved in any organization. I think it's best for our community if we raise that up a level, and it is a decision that, as administratively and governing bodies, we decide what is best for our community and not make it so it's pitting people against each other. And for that reason, again, I think changing rules and waffling isn't in our best interest of our community.
Waffling.
No,
Did it jump in between two parents, who's wearing a mask and who isn't?
I'm
But
not,
then-
and
We
for
look
that
at,
reason.
we look at the organization, we don't look at individual users
Exactly.
in that organization.
Yeah, and that is my point, that we decide how our facilities are going to be utilized, because it makes, again, why would we have any of our staff engaged in those very difficult situations? That it is absolutely unproductive to do that. I wonder if there isn't, I mean, if I was in charge of an organization, I wonder if there's not maybe, we take a week to try to process this rather than us, because we've been mandated to make this decision by Monday.
Okay, Councillor Barry's next.
Thank you, Your Worship. Some very interesting discussion going on here. A lot of very good information, and I appreciate the update. I also would like to say that I think that this is rather a large onus to be put on administration too. We appear to have fuzzy provincial guidelines, and administration has to make interpretation of those guidelines and look at how this is affecting our community. And can you imagine there's probably, 300-400 municipalities that are in the same position, all across the province, all making their own interpretations of a fuzzy provincial laydown that hit us the other day when we thought things were going quite well. I'm not going to get into a lot of discussion because I know I just have a few questions, but I find it very unfortunate that the vaccinated aren't protected. So now we have to go after the unvaccinated because they are the evil. I want to ask a couple of new questions, and I want to go back to the employees. When we take a look at the directives that came down provincially, one of the directives is to work at home when at all possible to work at home. So I'm assuming that we have a number of employees that will be assigned work at home. And part of my question there is, if they're working at home and isolated from other employees and from the public, why do they have to prove that they're fully vaccinated? The second part of that, which is somewhat related to it, is I know that we have a number of employees that work basically isolated. A grader operator gets into his grader, garbage truck gets into the garbage truck. Many of these employees really can be isolated. They don't have to go into a facility. They can just go and get into their equipment and go to work. They are not in contact with the public. They do not have to be in contact with anybody else other than cohorts that are employees, and yet they're going to have to show proof of vaccination. So I can see where we're serving the public that we may have a concern about following some of these conditions, but I think that we have many employees that we're going to be isolating from the public and isolating from other employees to a large extent. And they've been doing a fabulous job for 19 months. They did a fabulous job when there was no such thing as a vaccine. Now, because there are vaccines, some people in society are classed as unvaccinated simply because the vaccines aren't working. And I think this is a dilemma that we're in here right now, that we're making decisions to pit one class of human being against another class of human being and taking away their liberties. Part of my other question here is, if an employee decides that they're not going to get vaccinated because it's against their principles, are they being fired? So maybe you can sort through some of those, because I find this to be a very difficult decision to treat humans that have worked so hard and so faithfully, and suddenly we're laying down laws against them that is no fault of their own. Thank you.
Okay, Cliff, go ahead.
First of all, thank you for your comments, Councillor Berry. We did discuss on your first topic the working at home, and mandatory work from home measures are in place unless the employer has determined a physical presence is required for operational effectiveness. We had quite a discussion on this yesterday in our senior leadership meeting, and I'll use administration office as an example. The operational effectiveness is not there when we work at home. They have to pack up all their equipment. We don't have portable equipment, so it would be their workstation. We'd have to get printers, some type of devices for them to work with. When the restrictions came down in March of 2020, we did our best on a 2-week rotation basis. A number of employees felt very uncomfortable working at home and also in bringing confidential information out of the office. The exemption we made back in March of 2020 was for payroll. That person did not work from home. That person was stationed here full-time. We have we were looking more at the operational effectiveness, and we wanted to work within what we could to keep the employees here and to work in their workstations. And their workstation could be a piece of equipment, it could be an office, it could be a facility. So we are looking at where we can to keep the employees here and working. We have found that has worked the best for us. We did try in the past, it was okay, but it certainly wasn't the best. As far as the other comments, no, people will not be fired. There are, if they have exemptions, whether it's medical or religion, whatever, under human rights, all they will have to do at that point is put something in writing to us, we'll evaluate it, but they would be required to provide the negative PCR test every 72 hours. So we are not looking at terminating employees if they are not vaccinated, but the province has said that if it's an exemption, and although the province didn't get into the human rights issue, the only one that they mention is for medical exemption. However, there are human rights issues in there as well. We would definitely consider those, but we would not look at, our intention isn't to terminate the employees. The regulation or the protocols do state that an unvaccinated person would be required to submit their negative rapid test every 72 hours. So that's what we would base it on if they are not going to be vaccinated, unless things change in the meantime. But given the information we have at this point, that's what we would be working on. If the employee chooses not to, then that's their decision. But we will have to get further advice on that once this rolls out, because like I said, we just learned this yesterday as well.
Cliff, can you just clarify, you said with medical exemption, if they have a medical exemption, were you still saying they still would require the negative test even with the, okay.
No.
Okay, you're good with the
Well, I just want one quick little follow-up. So the situation is, if an employee doesn't wish to get the vaccine and doesn't have a medical reasoning, it's just his belief or her belief, then they have to go out of pocket every 72 hours in order to maintain their job.
Correct. That's what the province has laid out.
Okay. So what we have so far is we are going to, this is going to go, well, first of all, we had a comment from our CAO that this is a administration decision if we're going to go ahead with these measures that the province is bringing down. So we've all heard their comments. We've asked our question. Does anybody here feel that we need to take this on as a council and make it our decision?
Yes.
You do. Okay, we got one.
I understand operational, I just want to say that. I totally understand and appreciate what you're saying, Cliff, but we are talking about something that also impacts our employee, which is you. That's why I believe that we need to be part of that discussion. And also, I think we need some clarification, because as it reads, I don't read automatically that we are required to have employees automatically do these negative tests. That talks about them providing the negative test if you are taking part in the restriction exemption program and if you aren't vaccinated. I don't automatically see where it is saying that every place that is running facility is having to have everyone vaccinated. That would then be a provincial vaccine mandatory for all open spaces. That's not what we're seeing. So I think we need more discussion on it.
And who would you like to discuss this with?
Province. Because I got completely different information when I had a discussion yesterday than
On the user group.
on a couple of items. And unfortunately, this is not our admin's problem. This is crap that landed on your lap. I just want to be very clear. I don't blame our admin in any way, shape, or form, or any of our staff. I know you guys are doing the very best you can with stuff that landed on you. I'm just saying that the sad reality of what the province has done, again and again, is stand up and make an announcement that didn't have great information. Then they go and they put information online. And then they make reference to other orders online within that information. And it is terrible to deal with. So I just want to be very clear. My frustration is not with anybody at all in our admin group. It is with having conversation with a couple of members that I know work within the provincial government yesterday, which I called to ask for some help in my mind. And I'm not taking their word as gospel either, because I don't think anybody knows exactly what it is. What I'm saying is that I got very different information, because they did not pass where people have to have vaccines in order to operate. They passed where they have different regulations if you do or you don't. And I'm not saying that means we shouldn't. I'm just saying that's what it is. But we're acting like the province has said that everybody who is operating has to be vaccinated, and that's not true. What they're saying is that if you are not, there's different regulations. I just want us to be clear on that and look at it, because I'm not seeing where it's saying that if we don't pass a regulation, and I'm not saying we shouldn't pass a regulation for vaccination for our employees, I'm just saying that I'm not seeing where it says that if we don't, that we automatically have to have them testing every 72 hours. I'm seeing that as there,
Go
but
ahead,
Paul's
Paul.
good with that.
Just to clarify, you're correct. It does not say that in the government regulation. That is a decision that administration came to.
And that's fair, yeah. I just wanted to
That we
clarify.
wanted to have our employees vaccinated, and if they were not willing to get vaccinated and didn't have any other exemption, then they had to follow these rules. That's in line with what the city of Edmonton is doing, what the city of Calgary is doing, and some other municipalities, off the top of my head, I can't remember who they are, but I know for sure the city of Edmonton, city of Calgary are doing that. In fact,
And
the
I
city of
appreciate
Calgary
that
has
totally,
said
Paul.
their employees had to be vaccinated
Yeah.
by September 10th. So it was not the regulation. The regulation deals with whether the regulation actually says we can adopt the restriction exemption regulation, or whatever it's called, I never get it right, and not have our employees vaccinated. But administration discussed it and said, we need to have our employees vaccinated for the safety of our employees and for the safety of the public that we deal with on a daily basis.
And I appreciate that, Paul, and I'm not saying that I'm against regulation, but let's be clear, it was somewhat almost believed or suggested that it was a requirement, and that's what I'm saying. We need to look at it as what it is. It is a recommendation. It's a recommendation that's been well thought out and has, opinions brought forward, but it is a recommendation. That's the only part I want to clarify, because it isn't a provincial regulation, because we're kind of going under that this is a provincial regulation. That's where we started, and it isn't.
Go ahead.
One question that we haven't, that I haven't heard answered is this a concern for our employees? I know what we're discussing here, and we've got a range of opinions here, and I do feel like our employees aren't just simply our employees. These are people that have families and lives outside of our facility. For that reason, as a community leader, our administrative and governance powers as council and administrative teams make decisions for our employees that are in the best interest of our employees, as well as our community, because they're not just somebody that comes in and punches a clock for 8 hours. So have we heard from our employees what they feel about these potential decisions?
Excuse me, we have not put that out to our employees at this point, because we were going to, when I had the conversation with His Worship yesterday on this, we were going to have a meeting with the senior leadership and the managers, and to further discuss this with the employees. However, when the mayor got back to me and said that there would be a council meeting today, we've held off until there was a decision or information from this meeting. So at this point, from our best estimate and knowledge, we're looking at approximately 15% of our full-time employees that are not vaccinated.
Okay, so what does our operations look like if we don't do anything? The province is not making us do any of this. We either, go ahead, Cliff.
At the outline of the information, it says Alberta has declared a state of public health emergency. COVID-19 cases and hospitalizations continue to rise, largely in unvaccinated Albertans. New measures to protect the healthcare system, stop the spread, and increase the vaccination rates come into effect starting September 16. That's their overview for here. So it's anticipated and expected that employers will, and I'm looking at the town as the employer here, follows through on what the intention on this is to increase vaccination rates. And that's their overview.
So basically, what it comes down to is the basic question of democracy. The individual's right against the safety and well-being of the majority. That's what it comes down to. So what are we gonna represent? So, obviously, what we're saying is we don't feel we have enough information. I have a telephone call this afternoon with Minister McIver of the Municipal Affairs and the Chief Medical Officer, Dina Hinshaw. And hopefully we're gonna get some answers to some of these questions to move forward. Admin wants to implement this new policy on the 20th, which is Monday, with a little bit of leeway for, first of all, for the employees, that they have to have their first shot by October 25th. And we will have to see how it goes at our facilities regarding proof of vaccination until at least the 27th, or when they're more online. What is council's feeling here? Go ahead, Phil.
Your worship, I mean, we are giving our employees some leeway to get the vaccinations, and with what Councillor Wallace said and Councillor Rudick, I would be okay with a 2-week exemption to youth user groups. They would still have to abide by the restrictions if we do not do the full vaccination in. It'll be our dance studio and the arena. Of course, the curling rink isn't open yet, so.
And again, that's for adult, the curling rink.
Yeah, there is youth curling. I mean, but that'll be in November, that we'll have time to.
So what you're saying is that you're willing, the municipality is willing to meet with the user groups and go through the protocols and how this is gonna work?
Yeah, I'll, I can do that. That's a certainly fair statement. Like, we can give them 2 weeks, and, we'll have discussions with and it's gonna be limited groups, hockey, skating, and some dance groups that use our dance studio, to meet with them and go through and see how this can all play out. And like Councillor Rawa said, by that time, Skate Canada, Hockey Alberta, they may come up with their own protocols and rules to follow as well. Our pool and fitness center, we can't deviate. We either have to do the full vaccinations, or we try to, because trying to reduce that then becomes individual bookings and the reduction. So, I mean, we could do the exemption for the youth users, users. But when it comes down to like public swimming, we either have to reduce it to 1/3 and everybody stays in their little cohorts because that's what the rules say, or we allow full open swimming.
With proof of vaccination.
With proof of vaccination.
And come Monday morning, you would like to implement that everybody walks in there will have proof of vaccination.
In our pool and fitness center, yes.
So we'll be turning people away until they get these documents.
Yeah.
Even though the province system has crashed and there's nobody can get anything. Well, I guess you could go to a pharmacy and Councillor Barry.
Thank you, Your Worship. Just one additional question came to me here just right now. With the aspect that vaccines are waning and it's being recommended now for some people, and it'll probably become universal, that a third booster shot is going to be required. Is there a move afoot that employees will, in the very near future, have to show proof of fully vaccination in terms of 3 shots? Where is this going to be? Because, I mean, there are booster shots that they're being predicted, and I'm just wondering just how this keeps going down the slope here.
Paul Casey.
Thank you.
Thank you, Councillor Barry. The answer to that is we have not considered that. We are only right now dealing with first and second vaccinations, because that right now is considered fully vaccinated once you've had your second vaccination. And the third vaccination that is available right now are for vulnerable groups, for people over a certain age who have immunocompromised or people who want to travel. So it's not available to everybody in any event. So we have not considered third. We've only considered up to being what's considered fully vaccinated, which is 2 doses. And unfortunately, this is an issue because, and this is going to be my my own opinion, that the province has abdicated its responsibility by pushing this down on individual municipalities and businesses so that they can say, we left it up to the business or the organization to make that decision, so we didn't impose anything.
Yep, absolutely.
Okay, so we all understand the unfairness of this and stuff, but there's still a task in front of us, and that's what we do. We make decisions, so go ahead.
Sorry, this is what I would ask. Obviously, I understand what Phil is saying as far as timelines. I don't want us to say 2 weeks and we'll tell them that that's when it begins. I'm asking if we could put a pause on everything until Wednesday, until we've had a little bit more information. You've had a chance to speak with. Some of these questions could go, because maybe we aren't telling them in 2 weeks they have to do this. So what I'm asking is if we could consider a time period next week that we would re-discuss it again. I know all these things have to go. In the meantime, I understand that you have dates and regulations, and I would ask that until then we follow the youth regulations for the youth groups and the adults for the adult groups, and that we just pause for a couple days. I'm not asking us to not decide this. I'm just saying there's a lot of things that need clarification. So I think it would be fair to say, could we pause and have a discussion about it again, even next week after you've had some time?
Sure. So that's what I was gonna propose, is that I talked to the Municipal Affairs Minister and Dina Hinshaw today, bring up some of the concerns that we have. And then everybody can do some more research on their own, on council, and that we have a meeting on Wednesday. Now, we have RCMP grand opening, which has been canceled. So, and there's another meeting that the Councillor Barry and his committee needs to have is ASAP. So if we could reconvene this special meeting and come up with our decision. Meanwhile, we'll leave it where it's at right now with admin's recommendation, the go ahead with the provisions that we've talked about today. And by Wednesday, we will have a vote on what we feel moving forward. Is everybody good with that? Go ahead.
So I do have a question then. If we delay this decision, I would like it to be very clear what the expectation is in our facilities, because I know that I asked about dispute mechanisms, and I can say that there are parents previously and current that belong to both paid and volunteer groups that don't feel that they can voice their concerns about the use of masks, for example, in our facilities. So I'd like to be clear, if we're delaying the decision, which I understand, I'd like to know what the rules are and the expectations currently for both our users and our staff in our facilities.
Go ahead, Paul, please.
Just for clarification, Your Worship, are we talking about delaying all of this discussion,
No.
including the vaccination for employees till Wednesday, or
No.
just the
What we're saying is-
exemption restriction till
What we're
Wednesday?
saying is you guys can implement what we talked about today.
Okay.
And we'll do some more research, and if we want to reverse the decision on council, or we want to make changes to it, but on Wednesday, after a little more research for all of us, and we get some clarification from the province, hopefully in the next few days, about some of these issues, then we'll have a meeting on Wednesday, And if there's any changes that we want to put into your plan, that we'll bring them forth.
So what are they implementing as now? Because their plan originally was closing these things down, so.
Well, what Cliff has brought forward is what we're gonna go ahead with some of the variations that we brought forward, that the employees will be notified that right now, as of right now, they have until October 25th to get their first shot, okay? And the user groups will be working under the 1/3 capacity limit for now until there's meetings, and hopefully, from their governing bodies, there'll be more instructions on how they're gonna operate. Hopefully, within the next week, you would think that if the province brought this down, it starts on Monday, that minor hockey, minor soccer would have already some guidelines in place.
Well, they actually started on the 16th and
Yeah.
gave nothing.
I get it. So, but that's where we're at right now. So go ahead, where you're at right now, and any changes that council's gonna make to your plan will come on Wednesday.
Sorry. So are we saying we're allowing them to go ahead and notify immediately employees that they have to be vaccinated? Is that?
You can tell them that I feel that by October 25th is where it's at right now.
Are we voting on that at some point, I guess is my question? Or are we saying that it's not ours and we're not going to, as council, vote on whether we're doing
What
it?
I'm saying is that they can leave this in place right now, and any changes we wanna make will be done on Wednesday. If we decide as council that we're against this altogether, then we will change it then.
Okay.
But we haven't had a lot of time to do a lot of research, and I don't think the province has come up with good explanation on how it's gonna roll out. And if we go ahead and just carte blanche everything right now, what they said, there may be ways that we can make it better for our municipality. And I will ask the questions today, and moving forward on Wednesday, whatever time that we can set this meeting, and then we'll have a small meeting later with Councillor Barry's committee, because we don't have the RCMP meeting, grand opening. That's what I'm proposing. And go ahead, Cliff.
Okay, I would just like some clarification on that. You're saying that a notice can be sent out to employees today, and if I understood you correctly, you're saying it could be changed possibly on Wednesday.
What I'm saying is, you
just
told
want
us
to-
right up front that this is not a decision of council,
Correct?
that it is operational. And as a council, we have decided that we would like some information, we got it today, and we all know that if we make a decision as council, we can change things. So we're gonna look at it by Wednesday, after we get a little more time to have some more information on our own. I mean, the clarification that we're gonna need from the government is what the biggest thing is right now. So, you say that you have every right to go ahead and do what you wanna do, the senior admin, go ahead. And then we know, as a council, that we can override by a vote on the decisions. We know that can happen. Is everybody fine with that?
Well, I'm just looking at Cliff and I'm just thinking, he's probably wondering if we would not want to just wait till Wednesday and discuss as a group versus an override. Is that correct, Cliff?
Well, that's why I'm asking for clarification. If you want a message to go out today with a possibility of it being overturned on Wednesday, I'd like some clarification. Either I send it out today and have support of council, or we wait till Wednesday to send a message out.
Okay? Go ahead.
Otherwise, I'm in a real tough spot.
Yep.
Yeah. And
Well, I am too, because, I mean, I'd love to have it right now, have it out right now and say exactly what we all feel, but I don't feel that that's gonna happen today, so I'm in a tough spot.
Okay, I have no problem waiting until Wednesday for council decision and support if that's what the decision is of council. Okay, because I don't want to send something out and then a few days later, the potential of having it changed. Okay,
So-
I want it clear for our employees in one direction.
I think I'm going to use, and I hesitate to do so on a public format, but I'm going to use the phrase of a former colleague of mine. You're either a little bit pregnant or you're not. So I think, yes, and anybody who has worked with her will know who I'm speaking about. In this instance, I think it's difficult and confusing for us to give mixed messages. So I would say quite honestly, what we're asking administration to do is to do their job, administer their employees. If the province comes down with additional clarification that we need to revisit, then we do that. But I think from the discussion that I've heard here, if we needed to take a vote about anything, it's about the safety and sanctity of our employees and the safety and sanctity of our facilities. Those are the two decisions that we were discussing right from the very beginning. And it sounds like the only one that maybe has some further conversation that needs to be had is with youth groups or user groups that include youth. I don't know that there was anybody that was opposed. I think there are people that are opposed to the idea, but making the decision today, like, quite honestly, the discussion that you'll have with Minister McIver and the Chief Medical Officer of Health will give clarification and potentially a voice to the province to say, again, this was a decision that you needed to make, and municipalities across this province have been doing the work since this all came down last March and have been working hard every day to make sure that our citizens are safe and they have the services that they need. We've been doing that from the very beginning. We've been reliable, we've been responsible, and our staff have done a great job. So our decision here today is to give clear direction, and I don't know that we're doing that right now. So are we saying we're comfortable making the decision that administration do administer your staff? And if there are further clarifications that we need to look at on Wednesday, then we may need to clarify that. Because I'm confused. I can't imagine what they feel like. Yeah, because I mean, if they're.
That's not what I'm saying.
No.
I'm not saying I don't agree with that at all. I'm saying that we do have an employee who is our employee, and I think that we do need to give Cliff at least so he knows where we're at. And on each of and they're two totally different topics. One is the vaccination of employees, one is the administration of facilities. Those are two very different things. But I don't think we go back and say, no, we don't have any part of it. I would actually have a vote because I would have a literal opinion and vote on it.
And, sorry, Councillor Warwa, you mean today?
Whether it be today or whether we agree to literally pause it till we've all had time to think about, because this is a big thing. It is us deciding whether or not we feel we need to make a decision for our one actual employee, which is Cliff. And then overall, something that impacts the entire group. And it is, in my mind, a big decision because we are weighing what we think our rights are. We're not forced to do this by the province. That has been made very clear. So this is a decision of our group to impose a regulation, not a provincial imposing.
Okay, so there, it's clear as mud. Who wants to wait till Wednesday to give direction to what our thoughts are? One,
On both things or on,
on both, yeah.
okay.
3, 4, okay, you're waiting till Wednesday, Cliff? Hold on till then. What time works for you all to have a meeting?
Whatever you want. I'll make it happen, whatever.
What time is you got on Wednesday?
Oh, his rights is bad. Yeah. Between 3 and 5?
You got nothing else?
I have 8 till 10, just a second, sorry.
How's everybody, it'd be in the morning or in the afternoon? What's best for everybody? Let's see who's,
You could do 2
are you working?
No, I can be here on Wednesday. I
Okay.
can do 10 to 12.
Yeah, I know yours is. What about you? Morning or afternoon? Morning?
10 to 12.
What?
I could do 10 to 12.
10 to 12, so we'll allow 40 minutes for this, and then we'll move into your meeting.
10 to
Okay.
12? Okay.
10 to 12 on Wednesday. Okay. I now, oh, go ahead, Cliff.
Are you recessing this special meeting?
Yes, what I plan on doing is recessing it, yes.
Okay, thank you.
So I call a recess in this special meeting at 10:29.